When a senior and reputed political leader and former Minister of Kerala, Sri K.P. Prabhakaran, was diagnosed with cancer, his son, Sri K.P. Rajendran, who was the Minister for Revenue at that time, and his relatives, registered him at Alpha Pain Clinic on July 24, 2009. He was under the care of Alpha Pain Clinic till he breathed his last in August 11th the same year. Alpha Pain Clinic reaches out to all sections of society, whether affluent or poor. Alpha Pain Clinic ensures that the last days of the patient are spent with families and wishes and not in intensive care units or hospitals. Relatives and well-wishers of patients under Alpha's care often come to the clinic to express their gratitude. All of them are now part of the Alpha family. Over 7,000 people from all sections of society in the past 7 years have benefited from Alpha's palliative care and treatment. What started off with 1 doctor, 4 nurses and a group of volunteers has grown into a facility with daycare centers, 11 in-house doctors, 3 physiotherapists, 48 nurses, staff members and hundreds of volunteers. Prominent and leading members of society are also part of the Alpha leadership. They work round the clock, providing free care and treatment for the afflicted people in society. I expect to pass through life but once. If therefore there be any kindness I can show, or any good thing I can do to any fellow human being, let me do it now and not defer or neglect it, as I shall not pass the way again. K.M. Noordin, the founder of Alpha Charitable Trust, is a man moved by his compassion for fellow humans and their suffering. He was fully receptive to the humanitarian needs of people. At an early age, he used to accompany his ailing sister to various hospitals trying to deal with an incurable heart ailment she had. The whole experience exposed him to hospital wards and human suffering due to illness. After the death of his sister, he became acutely aware of the suffering endured by sick people. During the 1990s, when the first palliative care centers were being established in Kerala, he was among the first who offered his services to the Kozhikode Medical College. Besides donating the first vehicle towards palliative home care, K.M. Noordin was responsible for sowing the seeds of the first community-based palliative care system by sponsoring a project, the Neighbourhood Network of Palliative Care, NNPC. It was this experience that led to the founding of the Alpha Pain Clinic at Edamattam in Thrissur. With the help of a close friend and film star Sri Innocent, reputed doctors like Dr. K. Suresh Kumar, Dr. V.P. Gangadharan, Dr. Mushtaq Ali, Dr. K.K. Mohandas and Dr. Faisal Mohammed, Alpha Pain Clinic began functioning on May 3, 2005. Gradually, many more renowned people came forward to join hands with Alpha Pain Clinic as directors and patrons. Sri Joy Alukas, Sri V.P. Nandakumar, Sri Harshad Mehta, Sri V.A. Hassan, Sri Siddharth Balachandran, Professor P.C. Thomas, Sri T.A. Sundar Menon, Sri Lalu Samuel, Sri C.V. Rappai are among the patrons, and Dr. M.R. Rajagopal, Sri M.A. Ashraf Ali, Sri Sajan K. Matthew, Sri Ravi Kannambili now function as directors. Besides cancer patients, Alpha Pain Clinic also cares for those crippled in accidents, rendered immobile by disease, and those bedridden by illnesses. All services are offered free of cost. In Alpha Pain Clinic, you will find many people who have been disabled by illness or by accidents occurred for no fault of theirs. Thanks to Alpha Pain Clinic, most of them have recovered their lives and are on their way to becoming productive members of society despite their disabilities. Ajit, a professional photographer from Dubai, Tangamani, an aspiring musician bedridden for 15 years, are among the numerous people availing Alpha's treatment and care. Sumesh, who was bedridden for 5 years after an accident, has not only recovered but also supporting his family by selling lottery tickets. Like them, there are hundreds of patients undergoing physiotherapy at Punarjani who have been given a new lease of life despite their serious afflictions. Full-time physiotherapists manage this unit with the help of modern and latest equipments. The total recovery of a patient goes beyond just medicines and good treatment. We must not fail to see the economic and social crisis that looms before them. Alpha has a range of rehabilitation programs that ensure patients will be able to find means of livelihood after they leave the Alpha premises. Umbrella making, coir processing, setting up of small convenience stores are among the various rehabilitation programs organized by Alpha. Besides this, giving financial support for building houses, modifications to home toilets, and facilities for the disabled patients' travel are also efficiently taken care by Alpha. Long treatments and expensive medicines take a huge toll on critically ill patients and their families. In their desperation, they seek all kinds of cures and medicines, and invariably this causes serious economic stress. After the patient dies, the family has to bear the entire burden, and in most cases, they are forced to sell their homes to pay off the debts incurred during expensive and lengthy treatments. Keeping this in focus, Alpha has built 12 flats in its Edamattam center that can accommodate 12 families till they find a livelihood and a new home. The Alpha Rehabilitation Program has a strong component for children of patients under its care. Regular camps are being organized for children between 10 and 18 years of age, and in 2011, the Alpha Industrial Training Institute was established to provide job-oriented training to the children of patients. 50% of the seats in the ITI are reserved for children of patients. For unwed daughters and female members of the patient's family, Alpha provides financial support as well as arrangements for finding a good match for the girls. 5 sovereigns of gold and 50,000 rupees are provided to the newly wedded couples so they can kickstart their lives. More than 30 girls have already benefited from this program. The Alpha Hospice provides treatment for destitute patients, and there are now 12 patients undergoing care with a team of 5 trained persons taking care of them. Students for Palliative Care is a scheme that seeks to involve and sensitize students towards palliative care. Several programs are being conducted in schools and colleges for building awareness among students. Palliative care clubs have been formed to increase participation from students and to sensitize them. Since 2006, Alpha has been organizing meetings and seminars for students through the National Service Scheme in Kozhikode University for schools and colleges in Palakkad and Thrissur districts. Similar programs are also being carried out in Kochi under the Mahatma Gandhi University. These programs have managed to increase awareness of palliative care not only among children but to other sections of society as well. ₹1 1 life is a scheme for school children. With the consent of school authorities, a collection box is placed in each classroom. A student can deposit 1 rupee a day for 100 days, and this will take care of the needs of one patient undergoing treatment at Alpha Pain Clinic for 1 day. The child becomes a sponsor of an Alpha patient. In January 23, 2013, this scheme was inaugurated by the renowned social worker and former officer of the Indian Police Service, Kiran Bedi, in an event attended by more than 25,000 students. Alpha chapters are now functioning locally in several places. These chapters will have facilities for caring and treating up to 3 patients during daytime. They will be run by 3 nurses trained in palliative care. Doctors from Alpha Pain Clinic will visit these centers 3 times a week. To increase people's participation and involvement in its activities, a new scheme is being implemented in various panchayats. An elected committee from the panchayat, whose members contribute 100 rupees per month, will be steering the center. As more and more of these community-based chapters are added, patients will have access to palliative care and need not travel far for treatment. Alpha seeks to join hand with like-minded organizations to make available palliative care to all the people of Kerala by 2020. This is a vision that requires monumental dedication, kindness, and courage. It appeals to the essential goodness in the human spirit and fosters love and care for fellow human beings like never before. May the Alpha family of kindness, care, and love grow and become large enough to embrace the entire length and breadth of India and abroad.